ये सुझाव का जो भी है जी
अभी आ रहे सर सर
अच्छा
ये खोल रहे हैं
यही लगता है एक दो के बना रहे
मैं आपको दिखा देता हूँ।
अच्छा
देखो ये इनकी आर्टरी थी,
ओके
तो दिस आर्टरी इज टोटली ब्लॉक्ड हियर। ये देखो यहीं पे इट इज अ ह्यूज आर्टरी, इट शुड गो लाइक दिस,
ओके
so it is totally cut off here. See this?
या
Otherwise, if you see the other arteries, now this is the other artery. Okay. So this is the other artery. So like this, it should go down. So that artery was 100% blocked, and this is the third artery. So this is also almost normal. Okay.
ओके
Why I am saying almost? Because there is a slight narrowing, if you can see here.
Yeah.
Here, right?
राइट
And the left artery, and on the left side, the other artery also has a blockage, which I'll show you later.
ओके
So then we pass a wire through this. You can see this the
Yes.
wire is going, but there is no flow along the wire.
राइट
So then there are a lot of clots. So this dot is the dot of thrombosuction device. So we suck out the clots because once a artery is blocked and we give it more time, then the clots start to accumulate there.
ओके
Because clots are formed when the blood is stagnant. When it's not flowing, then the clots start forming. Okay. So after the clot thrombosuction, which was done repeatedly many times, so you can see a little flow coming
Yes.
here. Okay, you can see this flow which was not visible earlier. And
Right.
this filling defect which is seen here is the clot.
ओके
So then we again did some clot suction multiple times. Okay. So then we got this result. This result. You can see the flow going down also.
राइट
You can see there is a narrowing here also.
यस
So then we ballooned this. This narrowing was ballooning was done, and the ballooning was done here. So after ballooning and thrombosuction, this is the result. Now you can see the artery flowing down
या
up to there. So then we took this stent. So this is a 48 millimeter stent. This one from here up to here. These two dots.
ओके
And then after positioning, we inflate it. I'll just show you. We inflate it like this. Okay.
ओके
So then the stents. Now you can see the artery.
या
Very good flow.
यस
So this was totally blocked here, right at the start.
राइट
So then we take another short balloon and dilate it from inside at multiple places so that it gets nicely opposed to the artery from inside.
ओके
Okay. So after this, this is the final picture which we have got. Now you can see
या
this is the. So this huge artery was blocked right at the start. Now you can see the flowing. These are the branches. Now if you see the artery of the left side, the other artery, this is the other artery. So you see this is like going like this, but he has a tight narrowing here also.
ओके
So this is to the tune of 80%, and this also requires stenting.
ओके
But we haven't touched it right now because there is a rule if you treat a heart attack patient, there are a lot of clots inside. So when a patient is having heart attack and there are a lot of clots, don't touch any other artery if it is flowing.
ओके
We can do it later and it will be much easier and safer for him.
ओके
Okay, right now if we do it, there is now this artery we have opened, so there is still a 2 to 3% chance that a reclot forms here.
What is causing the clots? So many clots.
Smoking is the most important thing,
He's a chain smoker.
and diabetes is another thing.
Okay.
So these two are so there is still 2 to 3% chance that a clot reforms here.
Okay.
So that is why we keep him in ICU with a continuous flow of blood thinners.
Okay.
And gradually these clots will disappear and dissolve. So this should be done, and this should be done at least after 1 to 2 days. You can do it, you can get it done before getting discharged, and you may decide to get it done later also.
Later.
You can meet him, he's just going away. You can just meet him. 1 minute मिलवा के बड़ा